Hi, my name's Manoj, Krishna. I'm a spine surgeon, and today I want to present a case of a 55-year-old gentleman who had 6 years of neck pain and left arm pain. The MRI scans, as you can see coming up here, showed disc degeneration at C5-6 and C6-7, as can be seen from the arrows, and the discs are protruding backwards, reducing the space for the nerves and causing arm pain. On a cross section here, one can see that there's less room available on the left side, as can be seen on the arrow, as compared to the opposite side. And so the nerve is being trapped as it comes out of the neck. Alan had tried all the conservative measures, including physiotherapy, which hadn't worked, and therefore opted for surgery. I did a cervical disc replacement operation at C5-6 and C6-7. I took the old worn discs out and put an artificial disc there. This is a titanium disc which allows motion, and I think is better than the old fusion operation because it reduces the risk of failure of the other discs above that operation. Here's Alan telling the story.
Good afternoon, Mr. Krishna.
So, Alan, you're 55.
I am, yes.
Please tell me a story about your neck and arm problem.
Okay. Back in about 2006-7, I started to have some quite discomfort in the base of my neck, and I actually had an occurrence when I was on holiday. I had a very intense pain in my neck, which turned out to be a prolapsed disc at the base of my neck, which resulted in a huge amount of discomfort and a lot of tingling sensations down my left arm. And I actually sort of partially lost the sensation in one of my fingers.
That's 2007.
Yeah.
Okay.
Since then, that tingling sensation hasn't, that sensation hasn't returned in my finger. Okay. It's about 50%, I would say. But following on from that, I obviously saw the doctor back in the UK when I went home, had an MRI scan, and it turned out that I had actually had a prolapse disc in my neck,
okay.
C5 and 6. Didn't have any particularly surgical, certainly didn't have any surgical intervention at this point. It was more a case of the advice was you have to live with it.
Okay.
A bit of physiotherapy and all those sorts of things, which sort of eased it for a while. But then, of course, the symptoms sort of came back again, and I had another episode where most of the left-hand side of my body started to tingle, and you could feel something wrong in your neck. It's hard to put your finger on it, but it's like a low electrical current passing through your neck. It just feels like it's buzzing. So, of course, I went back to the doctors, had an MRI scan and a second one, and the doctor just confirmed that it's generally, it's got a little bit worse. But again, at this point, they weren't recommending any surgery. So I struggled on with that for quite a while and started to get quite worried about the continuing symptoms because these tingling sensations were coming back fairly regular, to the point where I couldn't sleep properly. I had to constantly turn over, move my neck to change positions. At that point I came to see yourself, who obviously made a diagnosis and carried out the corrective surgery.
The scan showed you had two discs that were worn and bulging and pressing on the nerves, so we operated on you about 6 months ago.
You did indeed,
We
yes.
did a cervical disc replacement.
Yep.
So talk me through the surgery and your recovery.
Well, the surgery came very quick after the consultation with yourself. I think it was only about 10 days, I believe. Again, I'm not a worrier in terms of the surgery wasn't the issue. I just wanted the surgery to fix the problem.
Yeah.
What was worrying me was the symptoms, or with the symptoms, especially this tingling sensation. Because in my simplistic mind, if something's rubbing on your nerve, it can only do it for so long, and eventually there's some permanent damage.
Yeah.
So I wanted the surgery doing. It was very quick, very efficient. I went to Stockton, that's correct, yeah. Met exactly on time. I was met by the ward manager, who explained everything to me, and I think virtually everybody concerned in the operation at some point must have said hello to me and explained everything, which was absolutely fine, no problem whatsoever. My wife was with me, which was a nice, it's nice to be able to go in with your wife. She sort of stayed in the area for a few hours whilst the operation occurred, And then when I woke, she was there, and we spent a few hours together whilst I recovered during the early evening. And then she obviously then went home, and I had a relatively pleasant stay. A little tiny bit of discomfort, but nothing of any consequence. Probably a lot less than I imagined. In fact, the discomfort was nothing to do with my neck. The discomfort is just the consequences of the surgery, I suppose.
Yeah. Anesthesia.
Yeah, anesthesia. Yeah, that's it. So the surgery itself was not a problem, and even the days following.
So you went home the next day?
I went home at about 11:30 the next day. So my whole stay was less than 24 hours.
Yeah.
So that was good.
Yeah.
But I say the surgery wasn't really a problem. I had a little few muscle pains afterwards, which.
How long did you take to recover fully from the operation?
I would say I was probably up and around with very little discomfort after a week.
Okay.
2 weeks, stitches were out and everything, and I was probably back to relative normality within 2 weeks.
Okay.
Depending on what your job is, I would imagine you could start work again. If you haven't got a particularly heavy job, you could probably go back to work quite easily after 2 weeks. Certainly, if you're office bound or not too heavy work, you could probably do it again quite easily. But driving a car and all those sorts of things, no problem whatsoever.
When did you start driving?
A few days, really.
Okay.
It was just not a problem.
And you're 6 months now?
Yep.
Doing well?
No issues at all with my neck. All those tingling sensations have gone.
No neck pain?
I get little aches and pains, but I think that's just my back generally.
Okay.
It's had a hard life. So, no, all the original symptoms that I used to get, I don't get anymore.
Okay. What sort of movement do you have, Alan, in your neck? Show me your range of
pretty
movement.
good movement. I can move it quite easily, both ways, and back. It was the back movements which was really a problem for me before. And on a couple of occasions when I probably overstretched myself, that's when I had a few episodes. You know, the symptoms would come back quite aggressively, and I would have all this tingling sensation. So that doesn't occur anymore. All that's gone.
Can I just put your neck back? I'll just show everyone your scar.
Oh yeah, can't I see
You
it?
can barely see it, I think.
Okay. Yeah.
You have to look really close to see it.
I don't notice it, and nobody else notices it.
Okay.
I guess I've got 1 or 2 wrinkles to hide it anyway.
Yeah. Thank you very much.
Thank you.